welcome to another episode of Prescription for Life. My name is Linda Golik. I'm the Health and Wellbeing Consultant at Emplify Health by Bellin, and I am thrilled today to be joined by Kim Shefchick. She's a PA for us here. She is actually in our Generations OBGYN department and the adolescent team. Mm-hmm. So Kim does a lot. Welcome.
Thank you. I'm so glad to be here. This is fun.
Yeah, great. So I really wanted to bring you in because I think it's really important for us to have some conversation around women's health. Mm-hmm. Obviously women's health has its own, purposeful things that we want to address, mm-hmm. and I just wanted to bring an expert in to have that conversation. So let's talk about the importance of women's health and particularly the screenings, mm-hmm. that are recommended. So
yeah. I feel very strongly about screenings in women. Obviously, as a woman, having a mother, having grandmothers, and now a daughter, I've seen that early detection saves lives. And I've seen it firsthand in my family members and obviously friends and patients. So I think that if we can really emphasize getting people in for their wellness exams, getting their routine screenings done, we can find things, we can intervene, we can work together and really make a difference. And then as women, we, let's face it, we are responsible for not just ourselves, we're caregivers. And so when we are well, it really does impact other people. So as much as we tend to wait and we say, oh, take care of everyone else, if we really do take care of ourselves first, it enables us to do more for our families and our friends and our people in our lives.
Yeah, agreed. So what are the recommended screenings, for women? When you mm-hmm. see patients on a daily basis, what do you recommend?
So I tend to think of it as that whole body approach. So
mm-hmm.
sometimes it's simple-minded logic for me, but I like to kind of think top down mm-hmm. because people come in for their women's health appointment and they think women's parts, my uterus, my periods, my breasts, but let's step back and remember we're a whole person too.
Yes.
So we think about brain health, we think about mental health, emotional wellness, we think about who's in our circle. So we always talk about social determinants of health and kind mm-hmm. of screening for all of those healthy things that we have, hopefully that we're doing in our life. And so beyond mental health, and we think about eyes, so vision screening, I always like to actually ask people, because I am not an eye doctor, but glaucoma screening being really an important piece. And then as we kind of work down through the body, so a lot of women in their families might have thyroid histories. We might do thyroid screening. One of our most important screenings is our cardiovascular screening, so thinking about cholesterol, blood pressure, exercise, nutrition, thinking about our lungs, thinking about lung cancer screening. A lot of people may or may not be aware that is also available for lung cancer screening for people who are high risk. Mm-hmm. And then getting into our gut, thinking about colon cancer screening, thinking about our pelvis, so our bladder, incontinence screening, cervical cancer screening, also then the whole skeletal system, osteoporosis screening. And then, of course, I really think just, again, taking in that whole person and remembering that a wellness exam is important. So just that overall touch point. I prefer once a year, although depending on your risk factors, you certainly could space that out a little bit more if you really don't have anything. But I think there's often at least one thing that we could sit down and talk about from a wellness perspective at least once a year.
Yeah. And I love that you're thinking outside of, I love that you're head to toe. That's incredible.
Oh, skin screening. How could I forget that?
Yes.
Skin.
Yes.
The skin suit. I call it the skin suit because, people get real nervous about certain areas of their body and they might never look at it themselves. So people kind of laugh when I have them put their gown open to the back. They're like, but isn't she going to examine my breasts? Yes, we'll do a breast exam. But it's really hard to see back there, so I want to look at your skin suit. Mm-hmm. And melanoma cancer, people think it's sun exposure, but there are areas where the sun doesn't shine that can get melanoma. So having that full skin suit assessment too. Forgot about skin.
Yeah. Well, thanks for bringing that up.
Yeah.
So you see women of various ages. I mean, you're
Yes.
anything from adolescents, probably all the way up.
Yep. Puberty to to the final countdown.
That's right. That's right. Exactly. That's good because you're going to be with me that long.
Great.
That's our plan.
That's
our plan.
I love it. That's literally my favorite thing about my job is getting to interact with people of all ages and stages. It's just so amazing.
Awesome. So how do the screenings or how does the healthcare vary based upon, the different demographics that you deal with?
Absolutely. Wide, right? And not just, women's health, but gender and sexuality health, so we take a patient in puberty, they have very different needs than a patient in menopause or perimenopause. And so thinking about what kind of needs do they have as an individual, but then also what's going on in their body. So if a person is coming to see me and they are really wanting to get pregnant, then we definitely have a different area of focus for their wellness because now we're thinking about them and a +1. So there's a lot of things that we may need to emphasize. And I think what a lot of people forget is how important cardiovascular health is going into a pregnancy too. And that certain complications during a pregnancy can then impact your cardiovascular risk after. So all of those head-to-toe screenings might kind of rise and fall in the level of importance depending on patient's age, stage, and what their goals are with their health.
So I know that you are used to dealing with the emotions of your patients as well, and I know for myself. I mean, sometimes it's scary to get health care. It's scary to get some of these screenings, and sometimes that makes people delay, on their health care. So how do you, as a provider, really manage that and just try to help patients in that way?
Yeah, it is incredibly intimidating for that first exam, especially that pelvic exam. It's very scary to have that first mammogram, especially one that gets flagged and you need additional imaging. It's very hard to have conversations about some of these things, especially if a person's had a negative experience in the past. So I think one of the most important things is to ask, what brings you in, right? And what holds you back from getting that care? Because I had patients who tell me, well, I don't want a mammogram. And then I ask, why not? And most often it's because of fear of something, fear of how uncomfortable it'll be, fear of how, what if I find out I have cancer and how will that affect my family? And maybe they had a loved one get cancer and they saw how horrible that was, but treatments have changed, screenings have changed. There's things we can always do to help people be more comfortable. And the little things matter, just hearing someone's story about what they're afraid of. And sadly, cost, right? So screenings may be covered, but if it's not normal, that has some expense. And so I've had patients who've delayed follow-up testing because it is an out-of-pocket expense then, because now it's not routine screening. And then what can we do to support them? Can we get case management involved to say, hey, you'd qualify for this scholarship that actually does exist for people who need follow-ups for their screening? There's a lot of programs sometimes that people just don't know about. And I think there's always opportunities to meet people where they are. So I've had patients where they physically cannot have a pelvic exam, but there may be other opportunities where we could say, you know what? Not that I'm in any way saying or implying people need to have sedation for all routine exams, but sometimes that's something we have to do because we need people to be their healthiest self. And again, I think if we listen and we ask why or how can I be with you in this journey, one of the things I love about Emplify Health, a plug for Bellin here, that we in our mammogram space, if you come to the hospital, you get that same day result. You get a plan. You get additional imaging if you need it right away. And they have nurses that come and meet with you after to kind of make sure you have your questions answered. It can just take that instead of waiting days, down to just minutes and hours of getting those same day results. I love that.
I love that too. Yeah. And just personal story. That actually happened to me where I went in for a mammogram, saw something they wanted to look further into. We can do an ultrasound right away. And my question was, then will I know something today? And they're like, we're going to look at it right away. We're going to have someone talk to you right away. And so yes, that was emotional and it was scary.
Oh, yeah.
But after those things went through and I got to talk to someone and this is what we think it is and we think you're fine. Now it's done.
Yeah.
And I didn't have to wait several days and then go through the sleepless nights worrying that something was wrong. So that is an incredible setup. I love that we have moved to that.
And yet we also have, our bus. So if a patient has a hard time getting into Green Bay, they can, go to their local area where the mammo bus comes. And now you might not get the same day results, but then that might save you some expense of driving down and taking off more time from work. So, just really balancing what are the barriers for patients, what are the hardships, where can we meet them?
Yeah, that's awesome.
Yeah.
Any new technologies, new things going on in women's health that you wanted to share with us?
Oh my gosh, there's so much. I think one of the most exciting things for women in general is the emphasis on getting more research into women's bodies and not just taking men's research and applying it to women. So that's just kind of a global answer. And one of the other things that we are starting to expand now more in our region, especially in our area, is the breast MRI. So women who have dense breast tissue, unfortunately, that can be a risk factor, increased risk for breast cancer, and offering to those patients breast MRI, bringing that cost down. So many women have been able to take advantage of that. And then a lot of work coming in the genetics. So looking at family history, seeing if a person might have things that are showing up that may mean if you had genetic testing, then it might give you some other opportunities for screening, again, to find things early. So again, family history being really important, genetics being offered. And then a lot of things with incontinence. I think too often we've left that in the shadows. Everybody's afraid to talk about it until it's incredibly difficult to ignore. But if we, again, get that intervention early, we screen people, we find it, we get them help, oh my gosh, it's life-changing. I mean, I've had patients who are starting to avoid leaving their house, and then they get help with our pelvic health program, and they are just back out living their wonderful lives and just didn't realize how much was available.
Yeah, good to know. Good to know. So for anyone listening or anyone watching this podcast that maybe they know they're behind on screenings, they know they're hitting ages where they should be getting screenings, they're delaying, what would be your message for them?
I would really encourage them to just make an appointment to talk about screenings. Screening exams are covered almost universally, and there's really that opportunity for so many options. So I think some people, colon cancer screening being a great example, like obviously colonoscopy is the best test, but the best test is the one you're going to get. So we have, the Cologuard that can get mailed to your house. We have, at-home tests and things and other opportunities, now even a blood test. There's things that people can do that may feel more realistic for them. But I think also just taking that mindset of knowledge is power. And I know sometimes knowledge brings some fear and some anxiety, and just recognizing that and figuring out where is it coming from. So I just hope that people are brave enough to at least have the conversation.
And I think that's such a beautiful way to start it, right? Like, just know you can come in, you can have a conversation. We don't necessarily have to do anything uncomfortable.
No.
But beautiful people, wonderful, warm people like Kim, waiting to provide your
maybe not warm hands.
And maybe not warm hands all the time, depending on the season.
Trying. I know.
But truly, like, welcoming, empathetic people that want to help take care of you.
Absolutely.
It all starts with that.
We have such a great team. I love our team. I love working here, and I've found, and not just women's health, our family medicine teams, pediatrics, internal medicine, like these primary care people are really wanting to see you and really meet you where you're at, no matter what your fears and needs are.
Awesome.
We have a great team.
Great.
And you know that.
I do. I am a frequent customer. What can I say? I use Bellin. I use Emplify.
Yay. Me too.
Right? We all do. All do.
I was a Bellin baby.
Oh, you were? Oh, that's so nice.
My mom, it's not like my birth certificate, but it's this cute little frame thing, and it's so, every time it's in my, memory box, and every time I kind of come across it for some reason, I always see Bellin Memorial Hospital, and it's just like, wow, literally the instant I existed, I've had that somewhere.
You were meant to be here.
Yeah,
You're meant to be here. Oh, that's awesome. Well, anything else you want to share with the audience? Anything we didn't get to talk about today? Any parting thoughts as we wrap up?
You know, I was thinking about that, and I think one of my mantras has always been it's a privilege that we have to work in healthcare, and I think we like to sometimes think of it as like this business relationship, you know, the patient's the customer, but I've always felt more like the hostess, and you're coming into this space of Emplify, and I'm like the greeter, the hostess, and like, what can we do for you? That annual exam is probably my favorite opportunity. Some people really hate annual physicals, but I love them because it's like, oh, I'm so excited to see you and meet you. What do you need? I mean, obviously I have this list of things that I want to try to accomplish, but it's really not important if yours has a different approach. And I think if you can approach your annual, not necessarily with that list of questions, but that mindset of who am I, what's important to me, and how can I find knowledge early as I come into the party of my health and my life and wherever I'm at. So like, think of Emplify Primary as your host and making your journey through your party of life. You know, I'm in the perimenopausal room right now, and it's not always a fun party, but we work with it, right? Right. It's a different kind of party. It's a different kind of party. But it has its advantages.
We're going to be okay.
We are going to be okay.
We're going to be okay.
Yeah.
All right. Well, Kim Shefchick, thank you so much for being here today, talking all things women's health.
We could talk about it all day.
We could talk about it all day.
But
maybe we'll have you back for part 2. We'll have you back for part 2. So watch for that. But thanks to all of you for joining us today. Please like, subscribe, share this podcast, and we hope to see you next time.
Thanks.